Hey there, history buffs. Today we're diving into one of the darkest corners of medical history, all brought to life in quirky claymation. Yup, you guessed it, we're talking about lobotomy. Back in the early 20th century, mental health treatments were, well, let's just say not at their finest. But one man, Dr. Walter Freeman, thought he had the perfect solution. Enter the lobotomy, a procedure that involved severing connections in the brain's prefrontal cortex. Sounds intense, right? Well, it was. Picture this, it's the 1930s. Mental institutions are overcrowded and treatments like electroshock therapy were the norm. Dr. Freeman, eager for a breakthrough, adapted a technique developed by Portuguese neurologist Egas Moniz. Moniz's procedure was revolutionary, but Freeman took it one step further. Imagine a time when someone thought, hey, why not use an ice pick? Freeman's transorbital lobotomy did just that. He'd insert an ice pick-like instrument above the patient's eyeball and tap it with a mallet, severing the brain connections. Crazy, right? Now, let's address the elephant in the room. Was this effective? Well, the results were mixed, to put it mildly. Some patients showed improvement in their symptoms, but many others were left with severe cognitive and emotional impairments. It was a gamble, and often patients paid the price. Freeman was a showman. He performed lobotomies in front of audiences, turning the procedure into a spectacle. He even traveled in his lobotomobile. Yes, that's what he called it, bringing lobotomies to hospitals across the United States. By the 1950s, lobotomies had been performed on thousands of patients, but the tide began to turn. As the medical community advanced, so did our understanding of mental health and brain function. The rise of antipsychotic medications in the 1950s and 60s provided less invasive treatment options. Freeman's procedures came under scrutiny. By the 1970s, lobotomies had fallen out of favor, seen as barbaric and outdated. Freeman's career ended in disgrace, but the legacy of lobotomy remains a sobering reminder of the lengths to which we've gone in the name of medical progress. Today, we celebrate advancements in mental health treatments, but it's crucial to reflect on our past. The story of lobotomy is a stark example of how far we've come and how much we must continue to strive for ethical and effective medical care. So there you have it, lobotomy in all its harrowing history, brought to you in the charming yet unsettling world of claymation. If you found this dive into medical history fascinating, make sure to hit that like button and subscribe for more. Until next time, stay curious, history buffs.